pleasure of introducing the last presenter today, Dr. Fahy Fahy. Dr. Fahy Fahy hosts the License to Lead podcast. By the way, I love that name, License to Lead, and owns Fahy Consulting, a leadership consulting firm in this area. And she's a former healthcare executive and board certified internist. Fahy is motivated to create healthy cultures to allow people to do their best work on behalf of patients. She coaches leadership teams to improve their internal communication and creates and delivers leadership development programs aimed at increasing the reservoir of excellent physician leaders. This is important work. I'm really, really happy to be able to listen to Dr. Fahy. Microphone is all yours, Dr. Fahy.
Thank you. Let me see if I can share my screen. You got that?
We do. Wonderful.
Excellent. Super. Well, thank you so much for having me. Thank you for your kind words. My talk is about the need for physicians to be leading the organizations where patients are seen and where the physician license, importantly, is used. And the name of my podcast and the newsletter, as you mentioned, is License to Lead. And that's because the profession of medicine and healthcare careers are not going to be saved, and patients are not going to be served. And that anti-innovation affliction that we call burnout is not going to be addressed unless highly regarded and clinically respected physicians are in the CEO offices and in leadership positions throughout the US healthcare systems and hospitals. And when I've heard previous speakers today refer to the C-suite not being responsive to the burnout of patients and not being responsive to this, or to burnout of physicians and not responsive to the suffering of patients, I think we have to consider what I call the BSM. And the BSM is the business school mindset. And it is the ideology of graduate business education. And this ideology is at the helm of more than 90% of US healthcare systems and hospitals, because physicians are the CEOs in only about 5 or 6% of the hospitals and healthcare systems in the US. So the BSM is a worldview that's, I would say, antithetical to the obligations and the ethics that physicians hold. So in this environment, physician autonomy is curtailed, and physicians end up in a vice between obligations to do their very best to serve patients and those demands that are put on them by their employers who don't share the same values and who, in worst case scenarios, are actually disdainful of physicians and physician values. So physicians end up being subordinated to those who simply don't have the same obligations as physicians. And this hour by hour and patient by patient conflict creates a threat state. And the threat state is called burnout and moral injury. And in a threat state, you can't innovate. I'm going to go to my next slide. So as physicians, we're told that we have some deficiencies as leaders and that we should stay in our exam rooms and just see patients and leave the managing up to experts. And I've rebutted these arrogant lone wolf physician myths in articles and on my podcasts, and myths about lack of ability to collaborate and lack of business savvy and financial acumen. And spoiler alert about the actual data regarding physician deficiencies in these areas, I'll just summarize by saying, au contraire. So there are 5 traditional professions, and the 5 traditional professions are architecture, engineering, law, medicine, and the clergy. And a defining characteristic of a profession is really an imbalance of power. It's a vulnerability of the client or patient. And in a typical business relationship, the legal rule, and this isn't a typical business relationship, the legal rule is let the buyer beware. And in medicine and really in any profession, let the buyer beware does not apply. The relationship between a patient and the physician is a special class of legal relationships called a fiduciary relationship. And a fiduciary is someone entrusted in a relationship to act solely for the benefit of the other. And so in medicine, the fiduciary is the physician and the other is the patient. So physicians are ethically and legally obliged to be fiduciaries for our patients. And I just would love for people to think about, reflect on how the physician's duty to patients ends up getting corrupted by having organizations led by people who have conflicting values, and in many cases, explicit fiduciary duties to their shareholders, to creating profits, not a duty to patients. So medicine's the only traditional profession that does not lead the institutions where our profession is practiced, or only in a tiny minority, the 5 or 6%. Even though arguably medicine has by far the greatest fiduciary responsibility. So, the great big architecture and engineering and law firms, even the multinational firms, with very rare exceptions, are led by CEOs who are highly respected professionals in those fields. And then that fifth traditional profession, the clergy, well, you can bet that your rabbi or your priest does not have an MBA telling them what to do. So what's the reality of physician leadership? Back in 2011, many of you will be familiar with this data. Amanda Goodall published findings that physician leaders outperform business trained leaders based on US News and World Report data that looked at hundreds of top hospitals in the US. And while only 5% of US hospitals were led by physician CEOs, when you look at the very best hospitals, 50% of those top hospitals had physician CEOs. And in the top 20 honor roll hospitals, 75% had physician CEOs. So physician leaders were really remarkably overrepresented among CEOs of the highest performing hospitals. And Goodall's findings launched a tsunami of research in this area, and the findings have persisted, and other researchers have done deeper dives. And there's also been an onset of research into this field to lay out why the expertise in the core business is so critical to success in any sector. So in 2021, at the beginning of last year, Newsweek, maybe not to be outdone by US News and World Reports, Newsweek looked at global rankings of hospitals. And 22 of the top 100 hospitals in the world were in the United States. And 4 of the top 5 were in the US. And the top 4 institutions in the US were all physician-led. And number 1 and number 2 are the Mayo Clinic and Cleveland Clinic, and both of these have been physician-led since their inception. So it's really interesting to consider that the US institutions that are physician-led are the best in the world, but the vast majority of US institutions are not physician-led. And overall, the US ranks dead last on the list of 11 comparable industrialized nations when looking at healthcare outcomes. So it seems like our potential for superb outcomes has really been diluted or polluted by the conflicting and profiteering motives at the helm of many of our healthcare institutions. Sorry for that pause, advancing my slide. So many of you are familiar with this slide showing the enormous growth in administrators during a 39-year period from 1979 to 2009. It's a 3,000% increase with a 2,500% increase in spending. The black line is the percent growth in US healthcare spending per capita. The barely visible red area at the bottom represents the growth in the number of physicians during these 4 decades. You might not be quite as familiar with this chart. This is data released by the US Department of Education showing the growth in the annual number of MBA degrees granted over the same time period from 1970 to 2010. In 2010, at the end of this chart's data, 170,000 MBAs were produced annually, and currently over 200,000 MBA degrees are granted annually in the USA alone. So if medicine's not leading healthcare, what are the values? What is the mindset or the ideology that is leading healthcare? And I refer to the business school mindset. The formal name of it is managerialism. And there's a boatload written about managerialism, mostly by extraordinarily gifted professors from within the business schools themselves. And the BSM is the ideology that emerges from graduate business education, a belief that organizations are best managed through hierarchy and control, with finances and profit as the preeminent outcome metric. The actual business or profession is irrelevant. So the expertise, products, culture, needs of those managed are secondary at best to the priorities of power, winning, and profit. And this is a toxic philosophy, and it has pervaded society. You know, just think Enron or the 2008 subprime mortgage crisis. And there is really no end to the research and data and escalating concern about the impact on society. And I think that the private equity inroads into healthcare can, in some instances, provide a distilled down look at the values and the outcomes of the BSM when it runs unchecked. So buying up nursing homes, stripping down the staffing and the support, reaping maximal financial advantage, and then having little concern for the increased mortality rate among private equity owned nursing homes, or pharmacy benefits managers, or insurance companies that are flagrantly insurance deniers, obfuscation of hospital pricing, executive teams with self-congratulatory celebrations and great big bonuses after a reduction in force of bedside nurses. So what does any of this have to do with innovation? So the clash of values within healthcare between the business school mindset and physicians creates a threat state. And physicians are in a chronic threat state. The suppression of physicians' autonomy to meet their fiduciary duty to patients causes burnout and moral injury, and it harms patients, and it hamstrings innovation. The most advanced part of the human brain is the prefrontal cortex, or the supercomputer that can be unplugged or hijacked when somebody is in a threat state. I use an acronym, CARB, to describe areas in our social interactions and in the workplace where we need to be kept in a state of safety or reward in order to keep our prefrontal cortex plugged in. The CARB stands for clarity, autonomy, respect, and belonging. And so if we don't have clarity, autonomy, respect, and belonging, it triggers a threat state. Autonomy is especially important in medicine. Physicians must have a level of autonomy that's commensurate with their level of accountability. So burnout and moral injury are a result of this chronic mismatch between the level of accountability for results and the level of authority that we have to actually create those results. And the threat state reduces, a threat state in anybody reduces flexibility, collaboration, creativity, empathy, problem-solving ability, and social connection. These are all critically important to innovation. So when physicians relinquish leadership of medicine to those who have a business school mindset, a BSM, physician autonomy is compromised. Sometimes it's gutted. Doctors can exhaust themselves leaping over hurdles, prior authorization demands, for instance, put in place by those who seek to control and monitor in lieu of understanding the core business. So here are some potential next steps I would encourage those who are viewing to consider. So as a physician, if you're working in an organization, a large organization with a high rate of burnout, take on a leadership role, run for the board. Fortunately, as a physician, you're a learning machine. And notice disingenuous public relations, disingenuous PR about the organization being physician-led. It's a huge advantage to capitalize on the public's trust in physicians by saying that the organization is physician-led. But if there's a high degree of burnout if physicians don't have control of their schedule or staff, or they're contractually silenced on their way out the door, if they have so-called dyad partners who are the ones who are actually paid to attend the meetings, and the dyad partners are actually the ones who have control of the budget, then the physician is not a leader, the physician's a patsy. If non-physicians are disciplining physicians or making hiring and staffing decisions about physicians, then it's most certainly not a physician-led organization. And it's important to create a tribe. It might have to be an anti-administration tribe. The physician license is required for the organization to function. Leverage that clear fact. A couple of physicians who raise concerns are disruptive, but a swath of physicians can redefine the organization and make sure that it is truly physician-led with a focus on patients. And I would really ask the listeners and viewers of this conference to focus on innovating in this space, creating physician-led organizations that do take exquisite care of patients and move the US from the bottom of the pack to first place. And in order to preserve the patient's trust, and in order to deserve the patient's trust, as physicians, we must act on our license to lead. Thank you so much for listening.
Thank you so much, Dr. Fahy. That is the end of our